Tēnā koutou katoa, tēnei te mihi atu kia koutou huri noa I te ao. I te mihi tuatahi ki ngā mana whenua, huri noa I te ao. Ko waiau, ko Ngāti Ranginui, Ngāti Rangi Raukawa me Ngāti Haua, ko Emma Waimari e Rawson-Te Patu tōku ingoa. I'm the president of the World Federation of Public Health Associations. Kia ora. If I had to choose one word for the 18th World Congress in Cape Town, South Africa, it would be kotahitanga. That word in my language, te reo Māori from Aotearoa, New Zealand, an Indigenous language, means to come together in unity in the most authentic way possible about encouraging each other to work together for the greater good. What does change look like when we return home from this event? For me, it really is about each and every person understanding how to live their responsibilities and obligations to the achievement of true equity and to the realisation of human rights for all people on the planet. And so when I say that, I mean that each person here in the space in Cape Town has understood about changing the way in which we practice that ensures that equity is created in every action that we do. So in my opinion, the single largest barrier in regards to linguistic or cultural needs in the public health community or the community at large is the continued presence of the Western view of how public health is practiced, of what is valued in public health, and indeed what is valued in knowledge systems widely on the planet. Until we can truly shift our view to understanding and seeing that many of the cultures and languages that hold deep knowledge on this planet actually outweigh the Western world, then we are not truly going to be leaning into the creation and the acceptance of what needs to happen for true equity for all. Having attended a number of World Congresses in public health in the past, I'm truly looking forward to the shift in the presence of people in Cape Town this year being really focused on true collaboration, true action for systemic change, because the geopolitical situation that we face is probably the most challenging of many of our lifetimes in regards to the hinge moment in time that we're sitting on to ensure that human rights are not outweighed by the oppressive nature of politics that do not serve the population at large. So I'm really looking forward to the Congress in South Africa because for the first time I will be spending time there. It's very important to me as a public health practitioner, as a human being on the planet, that I understand the context of every place in which I am charged with the work that I do as a public health person, but also as a fellow human being. And South Africa has a tapestry of history that many of us do not yet understand the intricacies of. And again, this means that if we are truly wanting to invest in how to support the communities that we are charged with helping, we must understand their context. And that means really making ourselves available to meet with the community, meet the people in the place where they are, and learn and listen to understand so that we can be better at all the things that we do. If I was to be given the microphone for the final keynote, my biggest message would be the same, I think, that it has been for some time. It is listen harder, do more, and work to be in relationship with each and every person around you, because that is the thing that is going to get us to the place that we need, which is greater collaboration, greater communication, greater engagement with one another as individuals and organisations, and less reliant on the political drivers that serve to divide us. More relationship, more time spent with one another. That's my message. I guess my final words towards this Congress and beyond is not to forget that the World Federation of Public Health Associations has done something historic in its time, and I am a manifestation of that history as the first Indigenous woman to lead the World Federation of Public Health Associations. That we have committed ourselves to understanding and delivering true equity as a public health community. And I would like to see us ensure that we continue to embed and understand and action all these things that this reflects as a true commitment to the future of equity and human rights in the world. Thanks.